Good morning, and thank you for joining me for this presentation. My name is Josh Allen, and I will be leading you through a comparison between three different countries and three different topics. In the end, I will make recommendations and do a personal ranking of how I feel each one of these nations takes care of their individuals and essentially make those recommendations towards the United States of how we can improve our own healthcare here in our own nation. The three countries we're going to be discussing today is the United States of America, Canada, and Australia. Each one of these delivers care a little bit different, and patient participation will play a huge factor into quality of care and the likelihood of somebody returning to that healthcare organization for the same exact injury. Of course, that plays into the cost of healthcare and how frequently insurance is paying out, which then, of course, raises premiums for every single person inside that nation. And then we're going to talk about healthcare coverage and how easy it is for individuals to access healthcare in each one of these nations. As I was saying before, delivery of care really focuses on how healthcare is presented and what the entities and organizations have in place for the citizens to receive that healthcare. So if we start in the United States of America, and I love what Edmund says here, who is a director at Harvard. She states that the healthcare sector in the United States consists of an array of clinicians, hospitals, and other healthcare facilities, insurance plans, and purchasers of healthcare services, all operating in various configurations of groups, networks, and independent practices. Now, there's a lot of benefits to having this amount of choices. It's almost the Walmart or Target effect of corporations, where you can literally decide where you would like to go. If you'd like to see an individual clinic or an individual doctor at that clinic, hospital, or even alternative care. Now, of course, here in the United States, we are all backed by insurance, and due to Obamacare, we all must carry insurance. Therefore, you are limited in what you can do and who you can see depending on what type of insurance that you have. Edmonds goes on to tell us that there's 1,500 different insurance organizations and various ways that people can be quote unquote insured for the delivery of care here in the United States. Canada is quite different. It is referred to as socialized health, but we will talk a little bit further about this when we get to the healthcare coverage. Essentially, even though it is seen as socialized health, it is accessible by every single person, and it does provide a lot of different options. Now, even though Canada is socialized, they still have opportunities and options for those who want to pay out of pocket and receive private health care. But this is primarily funded through the government. Australia is very similar, but we call it universal access because universal is implying that every single person in the public can attend a hospital, a public hospital, and will be reimbursed and covered for whatever they need to go for. There's also different incentives, but Australia is primarily funded through taxation. And there has been a lot of evolution in the Australian process over the last 100 years. What is unique and kind of interesting in the delivery of care through all three of these nations that they have in common is that they all face similar problems due to overeating, due to poor diet and exercise, and all face very similar types of disease states because of the lifestyle that each one of these nations can provide for their citizens. The United States delivery system today has been very structured and it's very bureaucratic, and this can have a lot of negative influences. But what we see is primarily insurance groups, HMOs, PPOs, governmental, non for profit, and of course self pay. Obamacare has really separated classes as far as economic classes and individuals. If you make more than $250,000 a year, you do not have to buy into Obamacare. But if you do not make that amount of money, then you do have to carry insurance. Otherwise, you will be fined at the end of the year. And essentially, this is a move towards socialism, universal care. On average, though, the average United States working citizen is paying anywhere from 15 to 40% of their income towards their insurance. And then on top of that, there are deductibles, co-pays, and different things that are still required from the insurance companies. And this is making it increasingly difficult for people to actually receive care. And we'll talk a little bit more about that when we get to healthcare coverage. But the delivery system is pretty straightforward. Here in the United States, if you are in a fatal situation or you have a fatal injury that will lead to death, no hospital can turn you away. But what the hospital can do is definitely send you a bill, collect on that bill, and essentially put that person into debt for several years. The delivery, though, is high quality, high technology. The benefit of being in the United States is that all of these doctors are very well trained, and we have actually specialized now. There's two different ways of looking at this. When you have a doctor who specializes in an area of medicine, then they are seen to deliver a higher level of quality of care, but unfortunately, the pay rate for seeing a specialist goes up tremendously. So we have seen the healthcare system start to be developed into a business system and business delivery. Now there's a lot of different management styles and things that we can do here, but ultimately the goal remains the same. How do we deliver a product or quality of care at a very high level with and at the same time reducing the cost to do this? Now, historically, it has been long wait times. There has always been a little bit of a shortage of employees. And with the recent Affordable Care Act, or otherwise known as Obamacare, we see that there is now 190 million hours of paperwork that is imposed on business. And this is one of the drawbacks to the United States delivery system. Is from the employer standpoint, they are the provider standpoint, there's a lot of red tape, there is a lot of bureaucratic things that have to take place. So even though in 2014 it was estimated that 3 million Americans were able to gain health insurance, we actually haven't seen these statistics and numbers quite yet. And what is happening a little bit more is people are actually refusing to pay into the Affordable Care Act and doing more cash pay services. And this is happening for providers as well. In America, we have Medicaid and Medicare, and Medicare and Medicaid are capable of writing laws and regulations and then holding providers to the standard. And if they don't meet their standards, then they are allowed to cut off their payment to them. So they will literally tell the provider, we will no longer pay you for any of our Medicare or Medicaid patients. And truly this goes for any of the insurance corporations, Cigna, Blue Cross Blue Shield. If there's not a level of quality of care that is being delivered, they have the right to quit reimbursing for those services. So that is one of the biggest issues with the delivery system today in the United States is that reimbursement of care. With HMOs, you do need to stay within network and you do need to see specific doctors and providers, which essentially is lowering your freedom of where you can choose to receive your care. And on top of that, you don't have to file claims, but you may be billed for things that were not covered by insurance after the fact that you have gone to the doctor's office. PPOs work very similar in the delivery of care, except for they do give you more of a wide range of doctors that you can go see. It's not necessarily in network. But the drawback to this is then you are stuck making your own claim and fighting for your insurance company to reimburse and support you in payment for the services that you have rendered. Now, on the next slide here, we're going to talk about the governmental agencies that do help in the USA. I think when we do talk about Canada and Australia and we see socialized universal, these definitely fall on their federal government and in different states, provinces to deliver and share the wealth. And here in the United States, we do take care of governmental workers and people who are extremely impoverished, and we will talk about that in the next slide. We also have a section of non-for-profit who does operate just strictly out of cost. And what they can do is lower the cost for all the individuals to receive care. We see this a lot in different states, particularly in Texas. There's a lot of non-for-profits that do want to help lower income families and do want to see everybody get quality of care. And then, like we were talking about before, the delivery of self-pay is really consistently comprised of personal decisions. Now, there are a very, very subcategory of individuals that can directly afford to pay for surgeries and different things out of their pocket, but a lot of these surgeries are going to be elective surgeries, so plastic surgery, different things like that that do require self-pay. Recently in the United States, there has been more validity to some of these alternatives of care, such as chiropractic, or what's also referred to as preventative care. In the past, preventative care was never backed by insurance, but nowadays you are capable of going to see the chiropractor, you are capable of seeing the dietitian, you are capable of doing all these different things that are helping to encourage patients and to get a higher level quality of health and overall life status. What I predict for the United States is that the states are going to start demanding a little bit more individual authority over how they deliver the care in their own states versus allowing the federal government to continue to write this bureaucracy that they don't even understand, and then to have judges rule on certain cases so that then it becomes a legal matter instead of a research-based progression. But we will talk more about that in later slides. As I mentioned before, when we're comparing governmental delivery of care, I think that the United States is often overlooked, that the government doesn't do a lot for certain individuals. And so this just breaks down some of our larger capacity programs that the government does offer, and it does kind of go through how many people it really does reach and help. So I just want to go through each one of these individually for a quick moment. Medicare, if you're not familiar with Medicare, Medicare provides it for aged and disabled individuals, and Medicaid is for low-income individuals and families. If you can look over at the expenditures side of this table, you will see that the federal government and state governments do support this as well. SHIP is for low income children, to ensure that children are capable of receiving quality care. The VHA is our veterans, and we are a very proud country. We do like to take care of those who have served in our military. IHS is for Indian and Alaskan Natives. The history behind this is we, of course, want to take care of them for essentially the capabilities we even have in our country. DoD TRICARE is active duty members of the military. So, like it states, just people who are actually active. And just to clarify, veterans are people who did serve and are out. Active duty is within that. And then we have FEHBP, and essentially this is for federal employees, dependents, and retirees. And there are a lot of different services that happen this way. For example, my father is a bus mechanic for a school in Colorado, and he is capable of having these type of benefits because he is in a governmental capacity. And it is very good not only through healthcare, but they do take care of them in a lot of different ways. So outside of all of the insurance and kind of mandated things, our government does make an effort to reach out to those who may not be able to participate or be economically stable. Now, the biggest delivery system for Canadians is the Canadian Health Act, where essentially the federal government backs each province government with payment and numeration so that they are capable of delivering high quality care to their individuals. Now, what's interesting is even though Canada is considered socialized medicine, there's a couple of things that are contradictory inside that statement. And one is when you have socialized medicine, all your providers are salary based. It doesn't matter how much or how many people they see, how many procedures that they can get through, they will make the same exact money. And in this sense, Canada is not socialized. In the sense that all citizens have access to healthcare, we can kind of lump it into that social feeling. But in all reality, in the economic and management side of things, it's just not true. The Canadian system actually allows doctors to privately bill on a fee-for-service basis. So essentially, this does allow for doctors to make better practices, to deliver higher quality of care, and to complete more or to see more patients in a day, and they will be rewarded through monetary for being a higher level delivery. In socialistic, it doesn't necessarily work like that. So Canadian system is a little bit different than that. And I do want to take just a quick minute to go back over what I meant by federal government and provincial government. Much like here in the United States, the federal government does oversee all the provinces, and if we can relate provinces to our states. And then the state province does have the capability of altering how the management and delivery goes for each individual province. But as you can see here, the federal government does reimburse those provinces for following the national standards. So it is kind of a similar system to the United States, and where if regulatory body or regulations are not being met, then the reimbursement for care is not there as well. But the one big difference here between the United States is that all citizens have access to health care. The Australian delivery system is also similar to Canadian in the fact that all Australian citizens are entitled to free treatment as a public patient in a public hospital. Now, the kind of drawback to this is that they will be assigned a doctor that they have to go and see through the hospital. Now, to keep everything even, the medical benefits schedule set by Australia's government pays a fixed amount of money for each service that is provided by these doctors. So the delivery system is also public, open. They do have a huge private sector, though, that if you don't want to report to the assigned doctor that was given to you, you can pay out of pocket and go to a private facility and seek the care that you wish to have. And so in this way, Australia is a little bit more progressive because like we see in the United States, we have all these other entities that we allot money to help these individuals that cannot get care. But in Australia, they still do that for every single person, and then they do also give you the opportunity to go seek private care and get your own type of care. So it's kind of a mix with Canadian system as well, except for, as we were talking about with the Canadian system, their doctors are capable of making more money in a day and doing different procedures. As far as reimbursement, then that's taken up through the claims and reimbursement through the government. Here, this is a fixed pay rate, very similar to our ICD codes here in the United States. The only thing that does differ is how much each insurance is going to pay out for those diagnostics in the United States versus here in Australia. They're set, there's no arguing, doesn't necessarily matter. To remove a tumor is X amount of money, and the size of the tumor then changes and that type of thing. This also does reduce fraud quite a bit. It is very difficult to abuse the system when it is set and regulated at this level. Patient participation has been a study for a very long time, and there are so many variables that influence this participation that it does make it hard to pin down which nation is doing the best job for this. I know we're not necessarily discussing European healthcare delivery methods, but I know in England they do reimbursement to the doctors for how healthy their patients can be, and that's an interesting concept that does encourage the staff to pull the patients and have them participate even further with them. But all three countries, United States, Canada, and Australia, all agree that this is a huge part of quality of care, quality of life after treatment, and the reduction of somebody coming back for the same injury over and over again. Now, the biggest variable that plays into patient participation is the clarity and cognition of each individual that is receiving care. For example, if you have somebody who has sustained a severe brain injury or has Alzheimer's, they're not really capable of participating in a way where they can be independent. They will always have some sort of dependence inside of health care. So these variables do make it more difficult for legislation to come in and say, this is what we want, this is where it's going to be. Now, even with this difficulty, though, the World Health Organization has set several precedents in the faction of how to involve patients and citizens in decision making in the field of healthcare. Now, a lot of research shows that when a nurse or provider starts to immediately recognize the independence in someone, then we can essentially hold them accountable and empower them to become more healthy and to take over their own health. And I think this is definitely a bigger issue here in the United States. the United States, we have grown into a psychology of entitlement. And we want quick fixes, we want it to be now, we want it to be done, and we want it to be minimal cost, and we want it to take as little of time, and we want to do as little as possible to get these outcomes. So participation in the United States has been widely varied between people who grow up a little bit more dependent, even psychologically dependent, and therefore when they fall ill, then they look for doctors, providers, nurses, even CNAs to be by their side for the rest of their life. But in other nations, there's reward programs, there's different things where patient participation is very much encouraged. And throughout all of my studies, all United States, Canada, and Australia agree that it should be up to the patient to direct and drive their care. Now, what's interesting about just saying that is that when a patient takes over, and lots of research has shown this, they have a faster recovery time. They do have a better opportunity to not be returning to the hospital for the same exact injury. And I think that's the key. When we're looking at reducing cost overall, we need to be figuring out ways that we can empower these patients, give them their independence, and allow them to direct their care. Now, as Williamson was talking about with the World Healthcare Organization, we have the capabilities of setting a standard and then showing the patients what standard they need to be at, educating them, taking extra time in rehabilitation centers, and even delivering home health care, and almost weaning patients from a dependent into independent status. And thanks to technological advancements, we have different ways and areas we can manage this. So we now have ways where people can wear necklaces around and have a page system to where if they have a slip and fall, or if they're experiencing chest pain, they can hit the necklace, the button on the necklace, and it will page out, and they will receive care. This allows them to feel confident and secure when they're at home and give them more of that empowerment. Dr. Henderson states pretty clearly that we overthink this sometimes, and that very simple things can be done to empower and educate patients. Simply giving them options of what type of treatment they can have. If they would like to go home and have treatment at home, if they would like to stay inside the hospital, if they'd like to go to a transitionary organization such as a rehabilitation center, assisted living. And therefore, when we give them options, we are allowing them to participate. And the more options we allow them to have, the more participation they will do. And then, like I stated before, the more participation they have, the better the outcomes, the better high quality of care or healing that goes on, and quality of life then increases. The unfortunate part in the United States that happens is that a lot of individuals have to file their own claims. And this can be very frustrating and basically leads to less compliance. And essentially, Americans want and often seek contradictory advice on the internet, which then, and this is an amazing phenomenon, that we will believe something somebody posts on Facebook over a medically trained doctor who went to 12 years of school and then has been practicing for another 10 years, and for some odd reason we believe somebody we've never met before, we know no background with, that simply posts something on the internet. And therefore the patients stop following the physician's orders and lead to more severe complications. Now, kind of doubling back to filing claims, even with Medicare and Medicaid, it's shown that people get very frustrated. They do generally have to go through several different loops, different entities to be reimbursed. and essentially give up on the process and end up paying out of pocket, or essentially leaving a tremendous amount of debt when they do pass away. And this does lead to our huge inflation prices in healthcare. And there have been legislation that's talking about passing different laws that would hold family members responsible for loved ones who do have a lot of medical expenses that were never reconciled. Until our government can come up with a streamlined process, though, I just don't see this coming to fruition anytime soon, or within the next couple years. Now, Canadians, they do not have to pay more to see specialists, but they can settle for a public doctor. What ends up happening for Canadians is they want to see a specialist, they have to get in a wait line. And sometimes this wait line can cause their illness to become even greater and cause even more risk. And so this is where the frustration comes from. Yes, a public doctor is provided, but if that individual doesn't feel comfortable with them, then they do have to sign up. They do have to wait to be seen. And then if they need surgery, that's generally a wait list to have surgery as well. And it is a big drawback. But as far as patient participation goes, it still gives them that independent empowerment to where they can choose where they would like to go for that as well. Now, Australia seeks to empower their patients and have them take accountability for their health. Now, they do this in a couple different ways, but essentially they have government mandated standards that say that all practitioners must hold their patients accountable to a certain level. Now, there is subcategories to this where if somebody is not capable, like I had mentioned before, Alzheimer's, brain injuries, spinal cord injuries, where somebody has no use of any of their limbs, then of course this independence and accountability is a little bit altered. But as far as standard of care goes, it is a common practice. It's what's taught inside of nursing schools. Dr. Henderson is on the board of a organization who does set standards for what the nursing schools are teaching their students, and it is a huge part of what is being taught to the students of how to empower and how to make the patients participate. And like I said, this isn't a lot of the times a huge drastic change. It's just simply giving them options and giving them opportunity to make their own choices. Now, actual healthcare coverage, meaning who has access to healthcare and how many people actually are capable of getting high quality of care. Let's go ahead and look at USA first. It is considered a free market. Now, I put that in quotations because after doing my studies and comparing it to Canada and Australia, I've actually found that Americans have less freedom to choose where they want to receive care. HMOs, PPOs, they all essentially force you to be inside of a certain network, and then you're limited to the options of people that you can see and do. A lot of our coverage in HMOs, we call it gatekeepers. So essentially you're going to have to see multiple people before you can even decide which specialist you want to go see, if you're allowed to go see a specialist. I will tell a personal story here with my mother-in-law. She has been disabled, and even though it's fantastic that the government supports her in her insurance, they also force her to go see different doctors, pain management doctors, different things like that. And sometimes those doctors don't necessarily listen to the patients. They write scripts and orders that are reimbursed by pharmaceutical companies and different things like that. So there is a huge business inside of our quote-unquote free market as far as when we can promise a certain organization that they will get X amount of business. and then we can essentially create insurance deals, and that's what HMOs and PPOs have been doing historically for a long time. So now, thanks to the Affordable Care Act, we are mandated that everyone has to carry health insurance or you will be federally fined at the end of the year. We are obviously still struggling in the USA to balance coverage for everyone. Even though we do offer these governmental supplement insurances, you still have to apply to them. You still have to go through a lot of red tape, and sometimes it's not as easy as we would like it to be. Now, as far as Canada and Australia goes, they offer citizens healthcare coverage no matter what. As long as you're a citizen, you are capable of receiving care. And it's not going to put you in debt for a very long time. It's not going to bankrupt you. One drawback to the healthcare system in the United States is that there are so many different operating individuals that it becomes very hard to bring it all together. And I'll give you an example of this. When somebody goes in for surgery, they have the surgeon that bills them, they have the hospital that bills them, they have the anesthesiologist that bills them, and then after all of that, the insurance comes back behind all of that and bills them for things that they're not going to cover as well. So it can become very intimidating, and with all of those different entities, then how one person practices business will interfere with another person practicing business. I read an article yesterday where an individual had to file bankruptcy. They were making payments to the hospital and to the surgeon, but the anesthesiologist refused to let them make payments and essentially took them to court and sued them for their portion of the money, and in the process they had to file bankruptcy because they couldn't pay the anesthesiologist. And then what happens is the anesthesiologist has insurance that goes ahead and backs him, and he gets tax breaks for losing this money, and essentially the taxpayers kind of fall back on this. And so even though the United States is not necessarily using taxpayer money directly for healthcare, it is indirectly, and it is directly affecting the coverage of care. Now let's go ahead and rank these systems. So what I did is based off access, prices, and quality that's being delivered, and then of course the three subjects that we had just covered, I went ahead and ranked these nations. And I ranked USA actually as the lowest here because it is absolutely astronomical, or just baffling to me how much money we spend inside of our healthcare system for the quality that we are delivering to people. If somebody has the capability of paying out of pocket and going and seeing a specialist that is very well trained, that can be paid more, then of course they're going to be getting a higher quality of care, but that doesn't make it even keel across the board. And I'll give you another example of this. Like I was referring to preventative care in USA, when you have certain types of insurance, you can't go to certain providers because they do charge too much money. Well, why do they charge so much money? Because they have extra education, because they have extra technology, because they're capable of delivering a high level or higher quality of care. So therefore, I went ahead and ranked USA at 6. Not saying that we have the worst healthcare system out there, because it is still nice that, like I said, if somebody is in a life and death situation, they can still show up and be taken care of. Now, whether or not they're pushed out faster than the average, that's a whole other discussion, and that also plays into access quality. Now, Australia I ranked at 7, and this was kind of a tough one. I almost ranked Australia and Canada on the same level. Because Australia does have a very good setup and delivery and management of care, and not only that, they do continue to alter this. And same with Canada. Canada does alter and does look at what they can do to increase the possibilities and help their physicians and help deliver a higher quality of care. I ranked Australia just a little bit lower than Canada, just because in Australia, for you to go get that private sector, that specialist, a lot of the times you are paying out of pocket, and you are assigned to one public doctor, and essentially you must see that public doctor. So even though it's nice, what if you don't get along with the doctor? What if you have a personality conflict with that doctor? Yes, you can request a new doctor. It does take a lot of time. Then you're getting into the bureaucracy of that. So that's why I ranked Australia at a 7. Canada, I went ahead and ranked at an 8. Because you are capable of seeking out different doctors, you are capable of going to specialists. Yes, you may have to wait a little bit longer, but in essence, I think they have the most freedom, and they are backed and each individual, each citizen is backed the most inside of the Canadian system. And I think when I want to compare this to United States, for example, my wife had to see a gastroenterologist specialist, and we had to call. We had to be on a wait list to get in and see him. So there's very little difference between the Canadian and USA in that manner. Other than when we went and saw a specialist, we had a higher copay. Nowadays, insurance in the United States divvies up the deductibles, so you have deductibles in each area of the healthcare system. So you have a specific deductible for pharmaceuticals, you have a specific deductible for surgeries, you have a specific deductible for specialists, and so no longer when you reach a certain amount of money do they reimburse you. And not only that, in the United States now you have a certain amount of money that they're going to reimburse you to. So not only do you have to invest a certain amount to even get reimbursement, but nowadays, if you overspend with pharmaceuticals, for example, then they will cut coverage off anyways, and it doesn't matter what type of premiums you're paying. And that's what it bases down to as well, is the premiums. So USA has some of the highest premiums. Australia and Canada have the opportunity of changing those premiums based on provinces, states, and the economic stability in each of the regions. And I think that's a very smart approach in general for managing the care. And that way, you know where to allocate funds and how to do different things. And essentially, you can imply then different management strategies, like we have been talking about, cost reduction and different things, and it gives it a whole better level of quality of care. Now, for my recommendations to the United States is I have several. As I was alluding to in one of the first slides, I believe that we should be giving the states a lot more accountability and allowing them to choose how they want to deliver instead of the federal government mandating how it's going to be delivered. Each state has a different economic status, and so what's being demanded of the bureaucracy and red tape that providers have to jump through in California is also being demanded in New Mexico, and it's a completely different demographic. Also, when we look at patient participation, that varies from state to state as well. Up north versus down south, the different seasons changing, the different opportunities for illness, all of this could be dialed in a lot more when we look at each individual state versus looking at the federal government mandating specific things for the overall nation. And I do believe that we can reduce costs quite a bit outside of publicly mandating insurance and forcing everyone to have insurance. I do think this boils down to an accountability that we have here in the United States. I really don't feel like we're holding individuals accountable on different levels of their own care, of having insurance, of different things like this. So what I would recommend is a system where a person is provided or is essentially looked at not only through insurance companies, but is looked through as like a case manager basis. And with this, then we could dial in who needs what care. And also, there's a huge growing concern in the United States about mental health. And mental health is becoming more and more of a predominant thing, and not everybody is receiving the care that they need. It's increasing homelessness, it's increasing violence, it's increasing crime, and so it's playing a huge factor. So if we were capable of being a little bit more integrated, states being able to offer more of their own systems, and not necessarily being publicly traded, would allow them more of an opportunity to be more focused on healthcare instead of business growth, shareholders, and really paying back their stakeholders. And I'm a little bit partial when I'm saying all this, and I do want to say this out loud. It is my opinion because I do work in the healthcare industry, and one of the more frustrating things is to work for an organization that doesn't see patients, they see numbers. And it's not necessarily about the quality, it's about staying within regulations and getting them in and out as fast as possible. We call it the McDonald'sization of healthcare, and it is almost an epidemic that's going on inside the United States. And I do believe that this needs to change. I do believe that we need to adopt more positive reinforcements for our physicians. Right now, our physicians will make more money, they'll get paid better the more ill the patient is. So they have no incentive to make people better. If we were to incorporate a system where when patients got better faster, we actually reimburse the doctor more, then we would start focusing on how to heal people faster. If we created a system where if doctors got individuals to stop smoking, or to stop doing things that abuse their body and damage their health, and then we rewarded the doctors for this, we rewarded the healthcare organizations, it would shift our focus into a positive reinforcement. And essentially, whenever we focus on something, we get more of it. And therefore, if we're focusing on positive outcomes, we're going to see more positive outcomes. Right now, we keep focusing on cost, cost, cost. Well, cost keeps increasing because we keep adding regulatory bodies, we keep adding tracking systems, we keep adding all of these different things that are increasing cost. But that's because that's what we're focused on. We're not focused on what needs to happen. And in my opinion, diabetes is an epidemic because we're not educating people. We're not showing people alternatives and things they can do that will increase their health standards. So my recommendation is to completely change the way we do our reimbursement here in the United States and get to a point where we do encourage patient participation, where we do encourage preventative medicine, where we do reward our doctors for healthy patients instead of sick patients. Now, I know that I have painted kind of a negative grim picture here, but I do want to also state how amazing it is to study 3 different countries and realize that the majority of people are capable of accessing care. That is wonderful. When we look back at the medieval times, or even historically how our societies have grown, this hasn't always been an opportunity or an option for the common person. So, or the lower class, as I should say. And so there is a sense of victory here, that evolutionary or evolution wise, we are moving into a better state where we do want to take care of each other, where we do want to see everybody receiving care. Even though the Affordable Care Act hasn't been overly successful yet in the United States, and I do preface yet, because Sweden launched their socialized medicine or universal healthcare, and it did take them 3 to 7 years to make it an operating system. So I do hold out faith and hope that it will develop into a better process and operating system. And Australia being capable of Australia and Canada being able to offer their citizens all healthcare is just phenomenal. You know, if, when I went into my debate, and obviously I said, you know, there's drawbacks to being assigned one person, but this is still great. There's still a trained professional that will assess this individual, that will make recommendations. This is all very phenomenal. This isn't just left to the elite anymore, and there's something to be celebrated there. So even though, like I said, I painted a little bit of a grim picture, I do want to preface that we are moving in the right direction. And studies like patient participation and delivery of care that are exposing weaknesses, even though we're seeing the weaknesses, we are shifting them into strengths that we can have. And so I do believe that the future holds a great um, prospect of being able to deliver high quality care at a very reasonable price. I want to thank you for taking time out to listen to my presentation, and hopefully you gained a lot of information from it and could connect quite a few dots that may not have made sense in the past. A lot of my references I do want to encourage you to check out as well. They are absolutely fantastic. You know, particularly Dr. Bernard, who is a Harvard director. She does a great comparison between Canada and United States, and does expose a lot of the myths and fallacies between the two, and how each one can be improved by looking at each other's systems. So thanks again, and I hope that you have enjoyed this, and many blessings and wishes to you.